This is Mark Knudsen, Chief Experience Officer at Synzi. Appreciate everyone taking the time to learn a little bit about the Synzi virtual care platform. Synzi provides a set of integrated secure communications that are really focused on enabling care delivery across geographic remote gaps. So whether it's a patient in home because of COVID concerns, whether it's bringing family members who are geographically distanced into care conversations, Synzi provides a solution that lets everyone get into the same conversation, ensuring continuity of care across providers, patients, and family members. What you're seeing right now is our virtual care platform geared towards providers and clinicians. And there's the ability to collaborate within a provider context amongst your colleagues and even amongst partner staff. So for example, just to show you a little bit of the capabilities, if I want to have a conversation with a colleague around a patient's care, maybe I'm getting a specialist opinion, to have a video call with that person is as simple as reaching out to them, letting the system handle the notifications, and bringing all parties into the video call. So right now you're seeing just a two-person conversation between myself and my colleague. If we need to have any visuals or nonverbal communication, we've got that advantage as well as the real-time conversation, and we can settle on the patient care path from here. So it's equally straightforward to have a secure message conversation, and often this is very convenient when you're communicating with colleagues. Looks just like a texting application on your phone or any other online chat application that you're using. Again, this is secure, so you can get into PHI level conversations, really get into the detail of any care decisions that need to be made. So speaking with colleagues is as simple as that. One of the powerful and I think unique things about Synzi is the ability to not only talk within your own agency or practice, but to also be able to talk with partner organizations. So for example, if I'm got a regular dialogue for referrals for patient discharge with an area hospital, I can actually have that back and forth planning session on the platform. I don't necessarily need to always be trying to play phone tag. I can do a video call with that individual if that's how our process is defined. And I've also got that secure messaging back and forth for, really maybe more of a as needed type of conversation. And this same concept can apply to area physicians that maybe are part of the patient's care that I'm providing. I can dialogue with them as well. So very straightforward to have these conversations, and that's really the point of Synzi, is to let people use whatever communication modality or channel is most convenient for the type of conversation that needs to take place. Of course, ultimately, what we're all looking to do is to deliver strong, better outcomes to patients, to improve their health outcomes, to improve their satisfaction with the care that we're delivering. So there's a variety of ways that I can communicate with a patient. Just to kind of bring in some of the additional video capabilities, let me reach out and bring a patient into a video call here right now. Again, there's no meeting invites that need to be sent. There's no meeting codes or IDs that need to be added. I just need to go through the system, and now I've got a patient in a secure video conference. We can get into whatever care we need. And it may be as we're having our conversation that it's appropriate for additional people to be in this conversation. So within Synzi, I can actually add additional colleagues, again, whether they're inside my agency or from a partner organization. I can add caregivers or family members. That's as simple as just going in and selecting the individual. Again, the platform will bring everybody in. I can bring in an interpreter even. So Synzi has a partnership with a company called Stratus Video that provides video interpretation. So if you have patients within your population that English is not their primary language or a language they're comfortable with, you can bring in an interpreter. So just what I'm going to show you right now is bringing in another staff member and how easy that is. So let me find Mike, who I spoke with earlier, maybe prior to talking to this patient, and I really think based on the conversation, it's going to make sense to bring him in. So I've got a chance now to, as the provider, highlight whatever video screen I want to see. So, you know, we're looking at a patient and a patient wound or something like that. I've got an HD level video that I can look at. So video calling is that flexible and that powerful. There are other ways, though, to speak with patients. So I can send them, based on their communication preferences, emails and text messages. Obviously, through those channels, I don't want to send any PHI, but I can use either custom content or content that's already been published and approved by my organization. And if I've got a reminder that's very important for them, all I need to do is send that, and now I've reached out to that patient. I've contacted them through everyday channels that they're likely looking at on a regular basis. I've also got the ability to do secure messaging, like I showed you on the staff-to-staff or provider-to-provider side. One of the powerful aspects of the secure messaging with patients is the ability to attach an image to this thread. So a lot of agencies and a lot of our clients at Synzi are providing remote wound care through the platform. The patient just takes their smartphone or their tablet, snaps a photo, attaches it to the thread. That image is actually not ever stored on the patient device. It's attached securely in this thread, and you can even download a high-definition full-image version to attach to the patient's note in the EHR, if appropriate. So lots of ways to make sure that we're communicating with patients, having the type of conversation that we need, and having it in whatever channel is appropriate. So video calls for urgent situations, secure messaging for things that can go back and forth a little more conveniently, and email and text for reminders or general education and tips. Synzi also supports automated schedule programs, which again is a set of reminders or other content, educational content perhaps, that are being sent out to patients. It's a great way to, especially if you've got a patient who's got a specific chronic condition or identify a diagnosis where you want to send maybe well-being tips or exercise tips, that you can do that between visits, helping surround that patient with regular care and guidance for, again, getting to the best outcomes. So all of these programs can be created within Synzi and assigned to the patient, can enroll it. It's really as simple as that. And now that predetermined scheduled set of education or content is going to be delivered to the patient. We also support assessments, which is a great way to get patient feedback in a structured manner without having to set up an appointment. So you can set up recurring assessments, you can do one-time assessments. The enrollment process is as simple as that, as we saw with the programs, where I select the assessment I want, and now that's been given to the patient to securely respond to. So one of the powerful aspects of virtual care is the patient being able to proactively raise concerns, communicate with their care team, and avoid the anxiety, potentially driven visit to the ER and, potentially even readmission from there. So again, this is completely configurable. Patients can communicate via video call or via secure message. We also support an on-call rotation. A lot of our clients take advantage of this, allowing a patient to be able to always reach somebody off hours, but not necessarily need to interrupt a given staff member. So Synzi will, again, automatically reroute any request that's going through the system to the first available person to respond to that request.